Hi, I'm Jeffrey Braithwaite. I run the Australian Institute of Health Innovation, and I'm a health systems researcher. And the topic that I'd like to address is future trends in healthcare. And what does that mean in the context of consumers? So I'm from the Australian Institute of Health Innovation. We do health services research, health systems research. And we're on the applied translational end of research, looking at how do we affect change, how do we describe and characterize the health system, and then how do we affect change in it through our research. Our motto, in fact, our logo for our faculty is heal, learn, and discover. And we find those three very evocative words. We're on mostly the discovery and the learning side of that, but it really epitomizes what we're trying to do here in the Institute. So just briefly about the Institute, there's 3 university centres in the Institute. About 200 of us are associated with the Institute doing all sorts of research of the kind described here. So I'm the director of the Institute. I also run a centre for healthcare, resilience and implementation science, looking essentially at change and improvement. Enrico Coira runs another one of the university centres that's part of our institute, and he is known to many of you. He's a doctor who became an informatician and is interested in informatics, AI, big data. Joanna Westbrook runs the third of our university centres, the Centre for Health Systems and Safety Research. She's interested in aged care, the epidemiology of healthcare, safety, quality improvement. We also have around us a number of National Health and Medical Research Council and Medical Research Future Fund grants. We have about 70 projects, funded projects at any point in time, but some of the main ones are described here. We have a partnership centre for health system sustainability, trying to improve and underpin the health system with research about its sustainability. An NHMRC Medical Research Future Fund grant, keeping people out of hospital. Another one looking at how good is the care from an evidence-based point of view to aged care populations, people in residential aged care. A Centre for Research Excellence, NHMRC funded in implementation science in oncology. How can we get better evidence into practice in oncology? Another Centre of Research Excellence in digital health, and a partnership project in digital support for aged care. And why I say all of that is to give a flavour for the kind of research we do. If you're interested in connecting with any of us about your research interests or your interests in improving the health system, we're all available. Just send us an email. Okay, so that's enough about the Institute by way of framing what I'm going to talk about. This talk is in really 5 parts. I'm going to talk a little bit about future trends and international themes, drawing on research on healthcare to 2030. Also going to draw on 3 big international reports that you may have come across, and if you haven't, I'm going to summarize them for you, published in 2018, which I think have yet to play out in terms of internationally, where are we heading with health systems. Also going to draw on our survey of consumers' view of healthcare. That's our survey. We did this, 1,000 consumers, pretty much a good sample of consumers that are generalizable to what consumers think about the health system. And then I'm going to bring it all together at the end. So, future trends and themes. So I'm series editor on a couple of book series, but one of those book series is about health systems. How are they performing in international context? And the third book in that series covered 152 countries with me as series editor and a whole bunch of editors across the regions, the WHO regions, looking at and canvassing the views of 152 countries on what they thought was happening to their health system projected across time. So I'm going to draw on that. If you want a summary, by all means, buy the book if this is your area of interest, what's happening around the world in terms of health reform and health improvement. But if you want a snapshot of it, well, we published a paper in the International Journal for Quality in Healthcare, which kind of conceptualizes what we're trying to say and conceptualizes this book. It's a big showstopper, this book, 500 pages or so, conceptualizes this into a roadmap of where we think health systems across the world are heading across this decade. Let me summarize it for you. There seems to be 5 recurring trends shaping health systems right across the board, low, middle income and high income countries, depending on the system. One is everyone's working on how do we create a system that's built to last, that is sustainable. Everyone's also working, more wealthy countries to a greater extent than low and middle income countries, on technologies and genomics. How is this going to affect the fact that we can do much more precision medicine rather than medicine that's one size fits all? What about emerging technologies of different kinds? New things to diagnose people faster, new drugs, new technologies, new IT by which to communicate and get faster test results, for example. So that whole technology bucket is the third one. The fourth one is the changing nature of demographics in every country, in every health system. Most countries are aging. Even relatively young population countries are aging quite fast, and populations are on the move. And demographics are changing. The patient populations we deal with are more demanding, for example, and requiring different kinds of care from the care that we could deliver, say, 30 years ago. And then finally, new models of care are emerging. We only have to look at the current pandemic to see that technology-induced distance delivery, telemedicine, telehealth, has become prominent in almost every health system. But that's only one of the kinds of new distributed ways we're delivering care. If you look on your iPhone or Android, you can find in the store hundreds of thousands of apps, and many of them are to do with healthcare and to do with wellness, integrating ideas and concepts into your life, to do with healthcare, getting test results, all sorts of ways of distributing the delivery of care. So new models of care, particularly enhanced by technology. Those are 5 trends shaping health systems of the future, summarized from this book and this paper that I'm relying on. Within this work too, those are the trends running through health systems. There are 9 main themes that every health system is working on to a greater or lesser extent. These are the 9, if you like, reform initiatives that people are working on. Everyone's talking about integrating health services. Everyone's talking about how do we afford this and how do we carve up the pie? How do we get enough money into the health system and how do we carve up the pie to deliver care effectively? Everyone's talking about patient-based care and empowering the patient so the patient's experiences and views are factored into the delivery of care to them. Everyone's talking about universal health care, but not every system produces universal health care, and some systems are moving away from the universal model. Australia, for example, has a very large private health system, which is fine. It brings more money into the system. But if it means there's a 2-tiered system where it's not universal healthcare anymore, that could be a problem. Everyone's talking about how to harness technology and IT. The final 4 themes, everyone's grappling with how do we deal with aging populations? And we're certainly doing that in Australia with a Royal Commission and the budget, which has put large amounts of new funding into aged care. Every country is also talking about how do we get better at prevention, because if we do better prevention, then downstream, we have less pressure on the acute system. But that takes time. Everyone's also talking about how do we do better policy, better accreditation, better standards. If you like, how do we get the formal system working well? And every country is also figuring out, how do we produce the next workforce? Not the current one, because the current one is fine in many countries, not all, but it's not fit for purpose for the health system of the future. So how do we get human development, education, training, and the workforce of the future? So there's 5 trends and 9 major themes running across the work of every system. And every system we found in that book, in that paper, and in other work is undergoing some level of reform. There's no system that's static. So added to that work, there were also 3 major reports produced in 2018. Sort of almost spontaneously, 3 different groups, the national academies in the US, the Lancet Global Health Commission, and the WHO, OECD, and World Bank produced 3 global healthcare quality report cards in 2018. I recommend them highly, and each paints a different picture, but synergistically, they tell you about what's happening internationally, allied to the book that I did with my colleagues. And I've published a summary of this too in open access in BMC Medicine, one of the medical journals. So again, you may not want to read those 3 reports, although I commend them to you, but you could read the summary of it that I've produced with colleagues in BMC Medicine on open access. And what do they say? Well, they say a similar lot of things to what I said in that book of 152 countries looking at global predictions for healthcare. So these are the key concepts. These are this is the word cloud of what's in those 3 reports. So it's about global and access and quality of care and improved systems and better delivery of care. And it's about health and countries and mortality. And there's lots of studies synthesized in those 3 reports. Here's the key themes according to how much they were mentioned in those 3 reports. Again, this is just the word cloud that I produced earlier in the last slide, but shown in a bar chart. And so my question to you, my first question, 2018 was the year of analysis and reports, and it was also about the time that I published that large compendium of 152 countries. So can we make the 2020s the decade of action, the decade where we start to really deal with all the things that are now converging on us as representing an improved health system and deal with that, actually make for a better health system? We are, can we do better? And then just to finish off this futurology side of things that I was asked to talk about, here's what the United Nations Sustainable Development Goals, the SDGs, for every country say. And there's a snapshot here of 17 key concepts that go to make up sustainable, healthy populations. And this is broader than just healthcare. This is about things like number 8, decent work, leading to economic growth. And number 7, affordable and clean energy. This applies to low, middle income, and high income. So let me switch gears. That's about the big picture and what's happening, I guess, in Australia, but internationally in every country. So we published a report, a study of 1,024 Australian consumers, and their views on our health system. I'm now narrowing down to Australia. So what does this sample that's reasonably representative of the Australian population, what do they say about the health system? The first thing overarching all of this is they think the health system's improving. So consumers actually think the health system is getting better. Can we do better even than that? Of course we can. But consumers are on side here and have a strong belief that things are getting better. 97% of health consumers are satisfied when they reported their last contact with the health system. 90% don't experience harm. We talk a lot about 10% harm, but 90% don't experience harm and get a reasonable experience and treatment when they interface with the system. And 87% of consumers are confident that they'll get safe, high-quality care when they fall ill or in need of treatment. About half of Australians reported that there are some good things in the system, but that fundamental changes are needed. So the report card from consumers is doing well, could do better. There's a substantial need, for example, consumers report, for more doctors, nurses, and other healthcare workers, and also those who are paying privately or who need to pay privately because that's where the care is being delivered to them, either through their insurance or with co-payments. I believe there should be reductions in the cost of care and medicines. 32% of people with chronic conditions found it difficult to make sure that they were understood and that their condition and problems were understood properly. 32% find it difficult, that's just a third of people find it difficult to discuss their concerns with their provider. And about a third find it difficult to find the right healthcare for them. And that's possibly because the system is so complex. Another half find it difficult to find out which healthcare services they are entitled to. This is universal health coverage, but how do you know what you get? And it's because the system, again, is so complex and there's so many different kinds of delivery mechanisms to consumers. And younger consumers, those who are not on a high income, and those with a chronic condition are the groups that perceive the greatest difficulty in navigating the system. That's because if you're older and have experienced the system a lot more, or if you have a reasonable income, you have greater levels of affordability. So what are the challenges when you boil this all down facing the health system from the consumer's point of view? Well, they're reporting shortage of practitioners, especially in rural areas, worries about access and affordability. There's also reports that GPs are feeling overworked, especially during the pandemic. There's also reports that introducing more technology introduces greater risk. And is that better care when I want, as a consumer, personalized care? And worries about the cost of care and that quality may not be improving commensurate with increases in cost. So how can consumers help shape the system if that's their views of the system? Here's some ideas we took from a recent talk Yvonne Zorinsky and I of the Institute gave at the Shifting Gears Summit of the Consumers Health Forum. There's a definite place for consumers. They are integral to the system. If you think about it, it's their health system. It's not our health system. It's not my health system. I'm a researcher. It's not the provider's health system. They're providing care to the people whose health system it is. So co-design, evaluating patient experiences along the journey, borrowing and drawing on consumers' expertise, knowledge, and capacity to help us change the system are all crucial. We think there should be formative evaluation that maps progress on a regular basis with consumers. And the question is the fit right between what I said consumers have expressed a need for in my earlier slides and what we're trying to do to improve the system along the way? So do what we're doing as researchers, what practitioners and policymakers are doing to improve the system, and what consumers want all line up. Are we doing what the consumer wants and needs is my real question. So let me bring this all together and time to conclude. In a way, what we're trying to do is rebuild an A380 while we're in the air flying it. We're trying to redesign the jet of the future, the passenger jet of the future, while we're flying in it at the same time. We're building the best healthcare system in the world. Policymakers, politicians, others tell us that for all Australians, but have we got the mix right? So from my point of view, there's all these things at the top of the funnel going in to this new healthcare system, this healthcare system of the future across the 2030s. And we've got a number of challenges and pressures on us. Let me just point out one of them, or two of them really. One is that's projected Commonwealth health spending. And you don't have to be a genius to realize that if that's the growth rate, that can't continue forever. So have we got sustainability baked into the health system? Have we got affordability baked in? The other thing is what I call a 60-30-10 challenge. Again, I've published a paper on this recently in BMC Medicine with colleagues, and it's on open access if you want to get it. And that says this. That says a report card about the system that says 60% of care is in line with level 1 evidence or guidelines. If you like, that's the quality of the care. 60% of care delivered is evidence-based or consensus guideline-based. 30% is some level of waste, ranging from administrative overheads that are too costly, through to futile care that shouldn't be delivered. That's where choosing wisely, of course, comes in a big way. And 10% is harm, that number where we say about 10% of all care attaches to it some level of harm when patients come to us for good care. 60-30-10 is the formula, is the mantra. And what we have to do is really beat those numbers. If we could beat those numbers, provide more care that's in line with level 1 evidence or guidelines, less wasteful care, less harmful care, we'd have a much better system. We don't really need any other indicators. And my final point is we are on a journey. We are leveraging resources. We are trying to do change more wisely. We are trying to create a sustainable health system. So can we have this feedback loop that does deliver improvement across time? Or are we at risk of stalling? Are we doing that? Are we going to, across the decade of the 2030s, produce a better health system for the patients who need it? That's my challenge to this conference. That's what I'm working on, trying to do research in this area. And I know that's what you're working on. Can we align all of our efforts to produce a better health system across the 2030s? So looking to 2030, we have to think, how do we want the health system to look? Is it going to be a learning health system? Are we going to do better at providing the right care at the right time for the right cost to the right patient in the right setting? Is it going to be more integrated care so people don't fall through the cracks? And is it a health system that will continuously evolve in collaboration with consumers? That's the health system I'm trying to produce through my research. That's the health system I would like to see. I think that's the health system consumers want. So there's a hi from people in the Institute, some people in my Institute who are saying hello to you. Sorry I can't be there. Here's some acknowledgements from some of the groups that work with me on various aspects of health systems improvement, researching healthcare. Here's some of my recently published books. I've drawn on a couple, but here's a few more that I've recently been publishing with colleagues. Here's some forthcoming books I'm working on. And here's how to get hold of me if you wish to. Thank you very much. Enjoy the rest of the conference. And I'm so sorry I can't be there.